perspectives on advancing digital citizenship for health. I know we have a few people who are still entering, so happy for you all to join us, but I want to get started because we have a full program today. On behalf of DTH-Lab and PLOS Digital Health, we are very happy for you to join us today for an event in support of Digital Health Week. So Digital Health Week is a global initiative organized by Transform Health. And as a partner of Transform Health, we support this event each year. And this year's theme in 2025 is the future of digital health to 2030. I encourage you to check out some other events taking place this week that all kind of happen at various levels of the global, regional, or national level. This particular event aims to showcase DTH-Lab's partnership with PLOS Digital Health, which was launched last year in November of 2024. This partnership really aimed to increase youth participation in science, to include and amplify youth voices in scientific publishing in order to build a body of research in digital citizenship for health and improved mentorship opportunities with their editorial board. In this mini collection titled Digital Health Citizenship, Advancing Digital Transformations for Health and Democracy, it was launched last month in October during Health Literacy Month. And it shared a growing body of youth-led research exploring how digital citizenship for health can shape equitable, participatory, and democratic health futures. Authored primarily by youth researchers from the Global South, this collection emphasized the meaningful digital transformation requires not just technology, but civic participation, health literacy, and good governance. I'll share a link to the collection in the chat in just a bit, or if any of you have it on hand, feel free to share it. But today's webinar will provide a platform for these young authors to share their insights, their lessons, and recommendations for advancing digital citizenship for health. Through open exchange and dialogue, these young authors explore what digital citizenship for health means to them and how current and future generations can become more empowered citizens and leaders in shaping these health futures. I'm joined today by two regional youth champions, both Caroline Nupp and Lydia Gara, who are both our alumni. They were involved in the other part of our partnership with PLOS Digital Health, which was a mentorship program. And today they're going to be the moderators of the two panel discussions. Just to give a bit of background on the mentorship program, they both kind of gained invaluable experience from seasoned academics on the PLOS Digital Health editorial board. And this included training and guidance and engaging in peer review, as well as opportunity to serve as reviewers on articles submitted to the journal after completion of their training. I realize I forgot to introduce myself completely. So obviously my name is Whitney Gray and I'm the Youth Engagement Coordinator for DTH-Lab. I work closely with a lot of these different authors, our regional youth champion cohorts, and kind of the overall work of the lab with engaging young people across the world. So before I hand it over to Caroline to get us started, I just wanted to say a big thank you to all of the people who were involved in making this event possible, especially to Miwa Akansaya, if I got that right. She's worked with us for a really long time and I'm still bad at names, so I apologize to Miwa. But she's our events coordinator and she's done a ton of the backhand hard-working aspect of this event. So a big shout out to you and all of your work that you've put into this event. Also, thank you to Louise Foley, our research and policy coordinator, who is a jack of all trades, who is exceptional and has put in a lot of valuable insights and contributions to this partnership. And then, of course, a big thank you to our partners at PLOS Digital Health, particularly Joseph Pold, who was a pleasure working with him, as well as Leo Sili. So lastly, I think before we get started, just a huge thank you to all of the young authors from the My Health Futures Youth Network. None of this would have been possible without your contributions. I'm so excited that the call for papers and mini collections is now launched and everyone has access to it, and that we're here today to hear more from the authors themselves and to have kind of an exchange of thoughts and reflections and solutions. So thank you so much for joining, and over to you, Caroline. The floor is yours.
Thank you so much, Whitney, for this introduction. I'm Caroline. I have been a regional youth champion of the Digital Transformation to Health Lab 2023-2024. And I'm very excited to moderate this first panel discussion on building trust, literacy, and participation in the digital health era. I think there's a lot of things to say, so we dive right into it. Before we start with the panel, I would invite all of our panelists to briefly give a pitch of their part of work of this PLOS Digital Health partnership. So I would start with Kate Barranco, who is the founder of Conscious Futures and an author with PLOS Digital Health. She's a researcher, designer, and a strategist, exploring how technology, storytelling, and also social connection shape well-being collectively. Over to you, Kate.
Good morning. Thank you, Caroline. Hi, everyone. My name is Kate Barinko. I'm based in Washington, D.C., and as Caroline very graciously invited, I'm the founder of Conscious Futures, which is a futures thinking research and design studio. Before I dive into just a brief explanation, I want to also give a shout out to my co-author, who is named Kendall Bryant, who is a true partner in thinking and imagining this piece. Our piece is called The Digital Crossroads, Media Literacy and the Future of Youth Online, which really explores this core paradox, which is that young people today experience connection and empowerment through digital spaces while simultaneously experiencing fatigue, desensitization, and a crisis of hope. In this piece, we argue that to support youth well-being, civic engagement, and agency online, we need to move beyond traditional media literacy, which often focuses on things like fact-checking. But instead, we need to move toward a systems-level media literacy, which is really grasping at things like understanding how algorithms shape attention and emotion, recognizing how design patterns are capturing and monetizing focus, and then simultaneously how building reflexes that help young people notice, name, and navigate these online influences. And this is important just in part because young people aren't users alone. They're growing up inside of these systems. And when you understand how digital environments work, they're not only safer, but they become active shapers of healthier digital futures. And we think media literacy acts as a foundation for digital health citizenship, not just as a coping strategy, but as a means to participate, advocate, and create with agency in their futures. So thank you guys for making space for this piece in the collection, and thank you to Kendall for collaborating with me in creating it.
Thank you so much, Kate. That was a wonderful pitch of your amazing piece of work. I'm very excited now to welcome Victor Femi-Laval to the stage. He's a medical student, researcher, and a youth leader working across Africa and beyond. He has published widely from the Lancet to international conferences, and he also serves as the research lead of the Africa Youth in Digital Health Network. Please tell us more about your piece of work and why you're so excited about it. Victor, are you here?
Yeah, hi. Sorry, I'm trying to set up. Yeah, so hi everyone. Can you hear me? Just trying to sort out
Yes,
my.
we can hear you now.
Apologies for that. Yeah. So Can I be seen? Am I visible? Sorry. Yeah. All right. So hi everyone. Yeah. Thank you very much, Caroline, for the very warm introduction. Yeah, it's such a pleasure to be at this meeting. So I'll just try to give a brief summary of some of my work. So my work basically looked at basically the the role of data protection and privacy in the digital transformation of health in Africa, especially. Of course, I'm from Nigeria, by the way. So yes, this definitely really applies a lot to of course, where I'm from and a lot of the issues that we do face here in this context. And of course, I wrote this article to my colleague Timilola, who also happens to study at my school actually. right? But we also work together a lot on a lot, in digital health as well. Yeah, so she also works with me. We worked together in the Farmers Technical Working Group on Digital Health and Innovation last year, and she's of course really passionate about it. So what we tried to do was basically look at what are the challenges, what were the problems that are associated with digital health, as we try to really transform the landscape of health with this digitization in Africa, and what are the problems that could arise, and of course how could we really address this. And of course we did try to look at offer various opinions. Of course, one of the things you find out that is that digital transformation, as the previous speaker did say, it offers a lot of advantages, right? For young people, but at the same time, young people are also vulnerable to a lot of the dangers and some of the vulnerabilities that are available that come with these systems, right? You find out that of course young people are of course a lot of times they can't maybe discern what is harmful on the internet, and of course like every other person, vulnerable to the violation of human rights, invasion of privacy and all this. Right, and it's just really important that as we adopt these digital systems, we also try to protect young people from the harms that come with these systems at the same time, right? And one thing that you find out in low-income contexts is that regulation and their enforcement is actually very slow. And of course, I think it's something that applies across the world, but I think it really applies in low-income settings or low-resource settings, right, where regulation is really unable to keep up with the pace of innovation and the rollout of these digital tools, right? And of course, very few countries in Africa have been able to actually outline specific considerations for young people, especially around this privacy and data protection. And even very few have the technical capacity to enforce these recommendations. That's something actually. So I think last month I was in London for a conference, and I was really able to see that there's a stark difference in the way the technical expertise in enforcing these regulations are compared to what obtains in, at least in my setting, right? And of course, we find out a lot of these regulations are fragmented, right? So we did have propose a lot of key recommendations based on what we found. We need a lot of inclusive data governance. We need strong enforcement, and the government need to really invest into the technical capacity to enforce regulations. We need more collaborative, interborder collaboration between countries to actually have more collaborative and stronger regulation frameworks. We also need a lot of digital literacy. So we have to engage the young people in this policy making and this decision making and governance, right? And
Thank you so much. I'm very sorry. I have to cut you off here because we have a lot of discussion going on later as well.
As we include
Victor?
digital transformation into health. Yeah. So thank you very much, Caroline.
Thank you. Yes, sorry, I didn't want to interrupt you. I know you're very excited about your topic, but we have many other very amazing speakers coming up, and we don't want to steal their time. So thank you very much, Victor. Over now to Rupal, joining us from the Indian Institute of Technology, Delhi. She's a PhD scholar and DTH-Lab research fellow from this program and focuses on digital trust, privacy, and equity. Please, I'm very excited to hear your 2-minute pitch on the most important ideas of your paper.
Thank you so much, Caroline, for the introduction, and thank you so much, everyone, for joining. So I'm from India, as you all know, and I did my fellowship with DTH in 2024. And we came across this paper. Actually, we built this paper called as Bridging the Gaps in Universal Health Coverage Using Digital Health Citizenship, where we argued that the digital transformation is not just about technology, it's so much bigger than that. It includes digital health citizenship, which comprises 3 components: digital literacy, health literacy, and civic literacy. And to make this real in practice, we came up with 3 layers as well, which is also given by Toyoma in his theory of technology as an amplifier, and which is more widely used in international development. So according to that, the first is access. That means building a public infrastructure that is open for and designed for people who are actually usually left out, maybe in remote areas, rural people, or informal workers, or maybe genders that are usually left out. And the second is capacity. Even if we provide the access to the person for digital services, but if they're not able to use those services, what is the point of that? So yes, digital skills are important, but secondly, I would also like to mention that capacity here also means that critical health and literacy, civic literacy. That means that ability to question the misinformation and to understand the data rights and to engage in how these systems are governed is also important. And that also comes in the capacity of this. And the third is definitely the most important one, is intention or motivation. So in the another study we did with DTH, we found that people in high income countries, even if they had the access and the capacity as well, but they were not actually ready to use those services. There were multiple reasons, and most important was the trust. People were not able to trust those services, be it for privacy reason, be it for transparency, data privacy, and so many reasons around that. So I think we need to have a comprehensive approach here. While we are supposed to build the public infrastructure around the digital health, we're also supposed to educate people to make the informed choices, and at the same time we need more strong digital governance and transparent policies that keep the user at the center of the policies. Thank you so much.
Thank you so much. Very interesting. Now, I would like to invite Salman Khan to the stage, a medical doctor and public health advocate with many years of experience advocating for youth-led initiatives. And we've been working together in the International Federation of Medical Students Associations, so that's why I'm very much excited to have you here. Please tell us a bit about your piece of work and what the main points are.
Thanks, Caroline. It's lovely to meet you again. And thanks a lot for having me here. Before I move ahead with the pitch, I would like to give a huge shout out to my co-author, Aditi Javeri, without whom this article would not have been possible. So the name of our piece is Combating Non-Communicable Diseases in a Digital World, Youth Shaping the Future Through Digital Citizenship for Health. Our main hook was that NCDs, or non-communicable diseases, as we know, are a generational emergency, and they caused roughly more than 40 million deaths in 2021 and hit lower and middle income countries the hardest. So our paper argues that the single biggest missed opportunity to turn the tide is the exclusion of young people from digital health systems that will shape prevention as well as early detection and long-term care. The problem that we focus upon in our paper is that traditional health systems and LMICs, they struggle to deliver sustained and personalized NCD care, and digital tools are scaling fast, but their design, governance, data practices are often decided, sadly, by a narrow set of stakeholders, producing solutions that are often unusable or biased or siloed. So the solution that we offer through this paper was proposing digital citizenship for health, a framework that puts youth at the center of digital health policy design and data governance. Practical actions including youth co-designing digital tools, youth fellowship embedded in primary health centers, seed funding and hackathons for youth-led innovation, and meaningful roles for youth in AI and data privacy policy making were some of the solutions that we emphasized on in the paper. We also pointed to scalable Indian examples like the Ayushman Bharat Digital Missions infrastructure, eSanjeevani telemedicine outreach, the Khushi Baby project, which I'll be later talking about, where community health workers use mobile technology to prioritize care. All these examples demonstrated how community-centered digital approaches can be adapted for combating NCDs, as well as low-cost interventions like M-diabetes text messaging also showed population impact at scale. We wanted to emphasize why it matters, because youth are digitally fluent, numerous, and are directly affected by NCD trajectories. So engaging them reduces biases in artificial intelligence, improves usability and uptake, and builds preventable habits on platforms young people already used. Our main call to action from paper was that to invest in youth leadership pipelines, which includes internships, policy seats, fellowships, and funding, and moving youth engagement beyond token panels to real governance power. So doing so will make digital health equitable, ethical, as well as far more effective against the battle against NCDs. So that's about it from our side.
Thank you so much, Simon. I think you all got an overview about the papers discussed, and maybe some of you have read them already. I think it's very exciting to have such a wide array of topics here. If you have any questions right now, please feel free to write them into the chat, or otherwise also unmute and ask. I would give you like a minute if some questions already popped up now. Otherwise, if not, you will have time at the end. So if somebody directly wants to ask one of the authors, please feel free to speak up or write into the chat. Okay, if not, you still have some time to think about your questions, and we will have them at the end. So we start directly into the panel discussion. And I would first invite Kate Barranco again. Kate, you write that platforms' algorithms are designed to promote more and more extreme content that draws and keeps our attention. I think that was very interesting when reading it. So can you maybe give us a real example of how you've seen that play out in real life, and what maybe young people can also do to take back control of their own attention and their time?
Yeah, absolutely. It's really important. When Kendall and I were writing about algorithms amplifying extreme content, what we're really doing is naming a design reality. So platforms reward whatever will keep us scrolling, and oftentimes that means that it's provoking content. So whether that's outrage or fear or identity polarization, etc. Obviously, I'm in the American context, so I'm seeing this in real time almost constantly. But an example would be when a teen starts interacting with harmless fitness content, and within weeks, their feed is pushing them alpha male influencers or incel adjacent ideology. That's one example. Another one is when it comes to a young person watching a climate video, and then suddenly their feed becomes nonstop collapse or catastrophe. And these aren't necessarily intentional searches. They're really algorithmic escalations that prey on vulnerability and emotional intensity. I know myself included, I felt that and felt how draining that can feel, being pulled into crisis content that we didn't really necessarily ask for, to the point where I even chose to delete certain platforms because I could feel that effect on my own body. And so whether someone decides to stay on social media or step away, because I really want to emphasize too that these spaces do offer meaning and connection, so there is value even with their risks. I want to offer sort of two practices really quick that can help. So number one, pause when your body reacts. So if you feel a spike of anger or fear or urgency, take a breath before you scroll again, and remember that connection online doesn't have to mean disconnection to your own body. I think that's an important piece of this. And then the second is just to curate with intention. So there are features that are like a not interested button. Limit your notifications and root yourself in offline connection. Of course, this is just a tiny piece of the puzzle. We need policy, we need platform accountability, but we also need young people to remember their own agency, that they're not just users, they are citizens within a digital space, and citizenship is so intertwined with agency. And you can choose how you want to engage and absorb. And I think the final thing is just to say, healthy digital futures really depend on young people not just having access, but autonomy. And that's the quick version, but I can see there are things in the chat, so I'll take a peek at that and I can respond in the chat just to save time.
Thank you so much. Yes, we will have the questions at the end of the panel. I really much loved the saying, just like, take a step back and breathe, because that's something you always hear in real life, but it also applies to the online world, of course, right? So I think that's a very important reminder here to everybody. So I would now go over to Victor. Actually, at this year's World Health Summit in Berlin, where we also hosted a side event, I heard the saying that Africa innovates and Europe regulates. And that really stuck with me. And I think it also very much fits with your point that in many African countries, data protection laws for young people are still very slow to develop and not well known. So where do you see like the biggest policy gaps compared to regions with strong frameworks like the GDPR in Europe? And what could African governments or regional bodies do to start closing them? And I know you're very much excited about your topic, but please try to be brief here and give like the most important advice to the audience. Thank you.
All right, thank you, Caroline. Yeah, it's very important question that you raised. Okay. Yeah, so it's a very important question that you've raised, right? Of course, that quote that you said, Africa innovates and Europe. And I think even, it's a very, very crucial point to state. So yes, but one of the things you will find, right, is that I think there's a lot of fragmentation, right, in terms of the regulation. So you talk about the GDPR, right? That applies for at least most of Europe, right? But in Africa, we have so many different policies across the various regions and even across the various countries. And they do, of course, have various differences, right? And that really causes a lot of challenges, especially when you're trying to take, digital innovations across borders, right? You're trying to scale your innovation, you find out that the regulatory environment in other places is completely different, right? And then you have to, both for the innovators and even for the users, there's a lot of challenges, right? You also find out that a lot of these regulations do not necessarily prioritize young people, and that's it's a very huge gap, I think, that we need to address as well. Then you also find very weak enforcement. I think I've said that as well, right? Sometimes you do have very nice policies on paper, right? But the technical expertise to really implement that is not available for those governments, right? Probably because of lack of investment by the government and commitment. So, those are some gaps that we find as well. Yeah, so those are some of the biggest gaps. So, and what would I suggest, right? I would say we need a lot of harmonization in terms of our protocols. We can have maybe an African version of the GDPR or something, right? Or some other protocol probably like by the EU or Africa CDC or some other very, continental network, right? That can develop such a framework that African countries can into use, right? And of course, we are beginning to see some of these things, but we need to get them more widely adopted. We need to also invest a lot more in, prioritizing the young people. That's digital literacy, youth engagement, in actually, involving young people in policy development and implementation phases, and of course, evaluation as well. And, we need formal engagement, not just, of course, not tokenism, right? And of course, we also need a lot more investment in the enforcement and capacity building aspect of these policies. Yeah. So thank you.
Thank you very much. Yeah, and I think also your point that we don't only need regulations, but we also need implementation is very important here, right? Because if we have all those policies and they're not being implemented, it's only half of the things that we want. So thank you very much for that. And I would now give the floor to Rupal. And in your piece, you talk about digital citizenship for health as a holistic way to bridge the gaps of 3 different issues, right? Access, capacity, and intention or motivation. I think that's a very interesting concept, and I would be very much interested in how this idea could be turned into real practice, and also what the differences are here between like low-income settings and high-income settings.
Right. Thank you so much. It's very important to talk about how can we translate all the talks and the words we're talking about into actually practice. So first is to, which I think is very important, is to, we need to move away from treating health and education in silos. Instead, they should reinforce each other by designing digital health literacy campaigns as the primary part of the, healthcare outreach. Another is to position frontline health workers at the forefront of the digital health strategies. They must be seen as a key enabler in adoption and scaling of digital health services. And coming on to where you asked about, LMICs and high income countries, I think here we really need to understand we can't take a policy from some country and we can't just copy paste it to another country. Policy transfer is important, yes, but understanding which stage the country is at the moment right now is very important. For example, building intention and motivation in low middle income country where access and capacity is not there would not make any sense. So I think it's really important to first understand the country geography and the social disparities and social lens, and then only we can actually look forward to a policy which is appropriate for the country. Thank you so much.
Thank you. Yeah, I think that's very important to always focus on like the area you're working in, right? Understand the context and then know what you can do. Okay, thank you. Now I would give the floor to Salman, our last speaker. And I would be very much interested in one of the statements you did. You said that the fight against NCDs can only be won if the generation most affected is also the one designing the response, right? So can you maybe like share an example, like very briefly, a real life example on how this plays out and how young people can really be involved here?
Yes, of course. Thank you for the question. I'll give you one concrete example that shows what I mean with that statement. And I also highlighted that in that paper. The Khushi Baby project in Rajasthan, one of the provinces or states in India. What began as a student-led design project at Yale grew into a decade-long India-based digital health organization that deliberately built youth and student leadership in their DNA. So Khushi Baby's early innovation was quite simple and elegant. They used NFC technology, which is called near field communication technology. They used it to make a pendant that carries a child's immunization record and that can be scanned by a smartphone offline. Now, this practical technology follows the child to every visit. Now, this device became a part of the broader community health integrated program that links community health workers as well as clinics, as well as state dashboards. So this team grew itself from public health students, venturing into solving solving problems in the grassroots, into an interdisciplinary organization that routinely, recruit students, interns, and young fellows in field teams and engineering roles as well. They have formalized fellowships, they have formalized partnerships with universities so that young people can contribute into data science and implementation on the ground. That's an example of youth leadership in practice for you. And that's exactly not tokenism. So the lesson is clear: when young people lead, from designing, sprints and field internships to core engineering and data roles, you get simpler and more usable tools. You get faster uptake by frontline workers. You get measurable public health impact as well. That's precisely why we must move on from consulting youth to giving them real seats at the table, which is happening, although it's, still slow in my opinion. So that's an example that I wanted to share.
Thank you so much. I think that's a very powerful example, saying what actually can be done and that youth can make an impact here. And I think that leads very much over to the questions we got into the chat. So a quick reminder to everyone, if you have a question, please feel free to write them. Otherwise, I will start with the ones we already received. And I think the question that Leo Celli wrote in the chat fits very well to your example, Salman. So maybe to all of you, what have we heard so far was mainly like voices from youth in the past, but how can we make sure that your voices, right? So the voices of youth here in the present don't suffer neglection and that they can really make an impact in the future. So how can we make sure that the work that you've been doing is really heard and understood? Who wants to start? Simon.
Yes, I think one thing that could be done differently is, defining co-ownership of data and the products, defining who owns data, how youth input must be incorporated, how youth input must be audited as well. And all of this should be transparent, open to public. Publish these decisions, data use logs, budgets, and meeting minutes in plain language, so that there's decreased uh, boundaries or decreased interface between the stakeholders who are actually deciding what's happening with our data, and that's also affecting the power structures which we are sort of living in today in the digital transformations, and the youth and the public on the other side. So this interface needs to be reduced. So that's my take on it.
Thank you. Yeah, I think that's a very powerful picture of having like this interface and trying to interact with it. Oh, yeah. Leo wrote in the chat that there's no incentive for those at power to share that power with us. What do you say about that? And what maybe also could be an incentive for those in power to really work here?
That's quite tricky, in my opinion. I'll give the floor to the other panelists as well while I think of an incentive.
Who has an idea? I know it's a very tricky question here. Kate, do you know what to do with this situation?
It's tough because it's like, how do we solve systems change and social change? And I think one of the things that I'm playing around with in my brain right now is that part of the issue, or how it relates to the piece that we wrote, was that we have become kind of used to wanting to see things at extremes. So everything is either transforming completely or nothing is changing at all, and we're not satisfied with the sort of incremental progress. And so I think part of this is understanding that, we're not looking at the past and thinking that certain youth voices were failed or that youth movements failed, but I think they've kind of laid the groundwork for some of the cultural and legal shifts that we are standing on and that these authors are building from today. And so it's not necessarily a fair question to ask, like, why weren't they successful or something, but I think it's more about like what systems sort of absorbed their energy and what are we kind of building from today. And I think young people today are equipped with different vocabulary around systems, around mental health that previous generations were not. So as it relates to power and incentive, like, you're absolutely right to call out that dynamic, that why would people in power want to give that up? But I think that that's also coming from the point that we are seeking power to look exactly the same. And I don't think that's our point. I think that's kind of the difference between young people today and maybe historically what change efforts we're focused on. I think we're kind of trying to reimagine things as a starting point. So I'm not going to give you the answer on how you solve that, but I think having conversations like these are a pretty powerful start to see how this is happening on a global scale. Like, whether you're in Africa or DC or Germany, we're all feeling this. So I think that's a really powerful global youth movement and conversation and dialogue that's beginning to really play out.
Perfect. Thank you so much. I love this discussion. In the interest of time, I think we have to go over to the next panel. But I think that's something we can all take away, right? Like trying to reimagine this collaboration. So before I hand over to Lydia, who is going to moderate the next panel, we'll take a quick group picture now. Okay, so please everybody turn on your videos when you're here and want to be on the picture, so that we can all remember these wonderful discussions we had here.
All right. Hi, everyone. Just very fast, we just want to take a good picture of the event today. Thank you very much for joining in. So please all, in the next 5 seconds, please turn on your cameras and say a big cheese once I say so. So yes, I know we have about 2 sliders. So yes, I'm about to take the picture. So one, just a moment. Okay, apologies, we have to go again on that. We're just taking about 2 slides. Okay. Say cheese, everyone. Some people are just good at their food. So yeah. This is just gonna take one more moment. We need the next one, slide. All right, I think we're good. Over to you, Lydia.
All right, thank you so much, Tomiwa. Good afternoon, everyone. And Caroline, thank you so much for moderating a powerful session. Yeah, so without wasting much time, we'll be moving on to the second panel, which is focused on from advocacy to action, youth are shaping equitable and sustainable digital health futures. And we'll be diving more into the youth-led innovations and strategies that are advancing digital citizens for health across different contexts. And with me, we have three wonderful panelists, young people that will be walking us through this second panel conversations. I have Sohila here, Sohila Heldip. She is the regional youth champion with DTH-Lab for Europe and North America. She's an environmental health advocate that is focusing on the intersection of health and sustainability. So over to you, Sohila. You're just going to tell us more about your paper in just 1 minute. Please, let's stick to time. Take it away, Sohila.
No worries. All right. Thank you so much, Lydia, for introducing me. And just like the previous amazing speakers, I want to acknowledge all of the amazing co-authors that were on this paper. Most of them are the other RYCs that I had the pleasure of serving with. So briefly, our paper introduces the concept or discusses the concept further for digital citizenship for health, and it connects it as a framework that connects digital health, civic literacy, and sustainability. We argue that as healthcare becomes increasingly digital, citizens must not only use digital health tools, but also shape them. So through advocating for ethical, equitable, and environmentally responsible health systems, the major point that we want to talk is like the triple planetary crisis, specifically linking climate change, pollution, biodiversity loss. We know that global health has an extremely, like just huge carbon footprint, roughly 5% of total emissions. And digital technologies kind of serve as a segue. So things like telemedicine and AI could potentially reduce the footprint because of all of the procurement that's used in healthcare, but if deployed smartly and also through a sustainably aligned governance. And the paper really wants to emphasize the civic responsibility, empowering people to manage their health data, combat misinformation, and demand greener healthcare systems, especially warning against health washing, where organizations make these empty sustainable claims. We want to call for accountability frameworks, and I'm excited to like potentially go into it more in the questions.
All right, thank you so much, Sohila. And over to you, Esther. Esther, she's a research fellow alumni with DTH-Lab, a digital health researcher, a One Health Tech fellow, and also she is the president of the African Digital Health Professional Network and other networks. So over to you, Esther. Tell us about your paper, and please be brief. Let's keep it short and simple. Thank you.
All right, thank you very much for having me. It's really great to be here, and well done with all the work that you are doing. So basically, my paper titled "The Heroes Among Us" postulated the fact that whilst we've seen, the topic has been overflowed about how digital health can really transform health and well-being for people. However, when it comes to implementing in communities, for the implementation to be effective, we need good change management to enable the communities to be able to, adopt it, adapt to their context, and also sustain the use of these digital health tools. So it's beyond just piloting or just giving them tools or putting platforms in their hands, but how are they able to use it in the long term, right? And so that we can actually reap the benefits that we want to see. And then, but a lot of mistake when it comes to implementation is the young people in the communities are actually often an afterthought. And so, but they are actually an untapped resource in the sense that they understand the community, they are culturally sensitive, and a lot of young people are tech savvy, so they can actually be the bridge that would enable communities to be able to, get these digital tools, encourage and even teach maybe their older counterparts how to use these tools and have a sense of ownership such that after the initial project is over, we can sustain the use of these tools and then be able to actually reap the benefits that we want to see. Of course, in the article, I made some recommendations, which I maybe will be able to go to in the rest of the panel session. But yeah, that's basically it. Thank you.
Of course. Thank you so much, Esther. We hear you and we can't wait to listen to more. Okay, so over to Ashwera. Ashwera, she's a dentist turned public health professional working at the intersection of digital health and social entrepreneurship. Ashwera, maybe in 50 seconds, just walk us through your paper. Thank you.
So yeah, my paper also talks about youth being digital natives in today's times, and it advocates for participation of youth as active contributors rather than passive recipients of digital health tools. And the focus is both at a macroscopic level from them being participants in decision-making and policy-making processes, but also being a part of the implementation and community engagement aspects when it comes to bringing novel digital tools and leading and making them effective, especially for those who are underprivileged and underserved. So youth can actually be those change agents for communities who are vulnerable or elderly participants and drive digital health transformation across the entire spectrum. Thank you.
Thank you so much, Ashwera, for that wonderful and brief highlight of your work. And I also want to use the opportunity to thank Sohila, Esther, and also Ashwera again for a concise summary of your work. So we'll be moving on into the panel conversation proper. And so for participants, please, if you have any questions, feel free to drop them on the chat and also tag the speaker you would want to respond to that particular question. Yeah, so Sohela, this question is for you. In your paper, titled Empowering Sustainable Futures, the Role of Digital Citizenship for Health and Healthcare and Environmental Resilience, you argued that digital citizenship for health positions citizens not just as beneficiaries, right, but as agents of systematic accountability. How can we then embed this framework into the architecture of global health governance, right? So that the sustainability and the equity that we'll be talking about becomes measurable dimensions of digital transformation rather than just aspirational rhetoric. Take it away, Sohila.
Thank you so much, Lydia, for that question. I think it's super important. And I think like a lot of the discussions that we're already having in the chat proves to be like what this question is asking, essentially like how do we take this to the next step and like go beyond just having like young people in boards. And we need to, for like my perspective in our paper, is treat digital citizenships for health like a financial compliance. We need to tie it to funds, procurement, public registries, and audits. I think AI right now is very exciting, but it also needs to be transparent. And right now is essentially our entry point to ensure that the standards and policies align with what we hope the outcomes would be. So that can look like maybe creating enforceable feedback loops. So like maybe quarterly comply or explain reports from like these healthcare systems, like really understand like if they're meeting these metrics or if they're just putting out like just goals for the year. We need to make sure that there's accountability, and that could be young people have like this amazing, powerful tool of like being vocal and also being online. We need to like essentially like expose like people who are not following these like carbon baselines that they're publishing or these ensuring that they meet these green and fair procurement statuses. And we just in general also need to spread awareness about the carbon footprint that healthcare systems in general have, but also what AI has. I've done a couple focus groups earlier this year, and that is certainly on a lot of young people's minds. But some people sometimes fail to understand the full capacity of how much like healthcare systems have a role to play. So essentially ensuring that people are aware about these systems, but then taking it to the next step of ensuring that we're holding them accountable, whether it be tying it back to like financial compliance, or through just like the transparency through like the post and pre-deployment checks.
Okay. Thank you so much, Sohila, for that short response. And from what you said, you mentioned that AI is exciting, and the most important thing is that it should be transparent. We hear you, and thank you for that. And also, over to you, Esther. And also, if you could check the chat, there's a question for you, right? So, and as you're going to answer this question I'm about to ask you, you can also combine it with the answer that, sorry, the question that has been asked in the chat. So, Esther, in your article, The Heroes Among Us, Leveraging Africa's Youth for Effective Digital Health Implementation in Communities, it makes references of successful youth-led co-design models like the Cyber Rwanda and also TuneMe. What lessons from these models can be adopted to scale up youth-led digital health interventions within Africa, particularly in the underserved communities? Take it away,
All right,
Esther.
thank you. Okay, thank you very much. I would answer that and also loop that into the question Andrews asked, and thank you very much for that. So, for instance, with Cyber Rwanda, when they were going to launch the project, they went ahead to engage the young people so that it was like in pilot phases, and then, engaged with them. They kept going back into, getting their feedback, all of those, which were then used to improve their process, the products, and of course, how they were implementing in different community areas. And I have a bias for that because as a product manager, we are also big on, iterative design, getting user feedback and using that to improve it. And even more than just designing the tools and the platform itself, you're also building in the implementation and the usability by the time you get into the end users and from the very start. So imagine you're trying to build a product, it's great, it's awesome in your head, it has all these AI, whatever capabilities, but you're not factoring in the context of the people who are going to use it. You're not factoring in maybe the language barriers, you're not factoring in a lot of different things. But if you had involved the youth in their community from the very start, they can let you know these dynamics. And so from the design and the building of the software or whatever it is, you already have that tackled instead of having to go back to 0 point when you've gone so far. That's a lot of resources, that's a lot of time and money that has been expended. Of course, contexts are also very dynamic and things can change over time. So of course, whether you did it right from the very start, there's always constant need to keep going back in and engage the people, because they are not meant to just be passive users. They are engaging with you. They are there they are important stakeholders to make your product or your digital platform better, because the end goal is the client. The end goal is the person who's going to use it, not just how it looks for you or 5,000 people are on our platform. So what? Are they using it? Are they using it effectively? And are they gaining the benefits that it's expected? And so I think I would look that into what Andrews asked about how African's country can bridge the gap. I would say one easy way is to maybe use low-hanging fruits. In the paper I wrote, I mentioned maybe leveraging existing structures. For instance, I'm from Nigeria, and we have these National Youth Service Corps programs. And for medical people, there's also the health initiative for rural dwellers. We have the medical CDS, medical community development service, where you volunteer your time aside from your primary place of assignment as well. So imagine people already entering into rural communities who are maybe doing health education, outreaches to them and all of those things. Then you layer your digital platform implementation program. So apart from just teaching them digital literacy skills, which a lot of people talk about, you then leverage the health systems and the context sensitivity that they have, tie that together. And so when they are entering these communities, they already have trust. they're already well known, right? These people trust them, they listen to them. So you can then layer that with, oh, there's this tool, this is how you can use it. And then when they have questions, and also that can be a good way to use them as young people to, build on an existing structure to implement effectively in those communities.
Yes.
Yes. So
All right. Thank you. Thank you so much, Esther, for that wonderful response. And also for the other panelists, please feel free to go through the chat and reply to as many questions you can reply to. And over to you, Ashwera. Based on your work, based on your article, can you share your perspective on how digital health governance, how digital future health governance systems can be designed to empower young people as active rights holders and also innovators, ensuring that they are not only navigating, right, but also they are redefining the digital ecosystem that continue to shape their health and total well-being. Over to you, Ashwera. Please be brief, keep it short and simple. Thank you.
Thank you so much, Lydia. In my opinion, digital health governance frameworks or guidelines conventionally are top down, and I'm from India, so in a country as diverse as India, and for example, as Esther was saying, Africa, we have the demographic dividend is mainly contributed by the youth, and therefore their voices and their involvement in this entire governance framework development is equally important, and we all agree to it. But to me personally, the way of engagement again is too tired. So, or we can say there are two approaches. One, young people, for example, I myself was a young professional working with the top leadership at the Ayushman Bharat Digital Mission, which actually laid down the digital health governance framework for India. So opportunities like these fellowships or young professional programs or being part of research and academic institutions that give you that exposure to be a change agent and ensure that your voices are heard when these decisions are being made by the top bureaucrats or policymakers. I think that is one route that that needs to be facilitated for young people, and all the young adults need to be aware of these opportunities and actively pursue them. The second, which I also highlight briefly in my paper, is that we need to look at engagement from the community perspective. So as as young people, we are talking to people who are younger to us, also our parents, our colleagues, and everywhere that we work or in our personal spaces as well, and gather all the different diverging concerns and thought process that they have. Particularly in my professional experience, I've seen that people are unaware of the privacy legislations, the right to having the ownership of their own health record, which is by law or regulation. The health record is a citizen's own. It is in their hands, and they own their health record. So a very minute, generic concerns that people around us raise, if you're able to address that in our conversations, in our daily conversations, and ease their concerns, and then take those insights and fuel them into the work that we're doing as part of being as part of institutions that we work in. I think that will that this dual approach will help us create the right balance in ensuring that the digital health governance frameworks are equitable and representative and contextual to the environment that we're operating in. Thank you.
Thank you so much, Ashwera, for that wonderful and thoughtful response to your question. So right now we're going to open the floor to participants to ask questions where they're not clear or they need more information, or you just want to drop a comment. So the floor is open to all participants. Kindly unmute yourself, ask questions, or you can just drop it on the chat. All right. Well, if you don't have any more questions, please feel free to send DTH-Lab emails if you have any more questions after this panel conversation. And so thank you so much, everyone, for your rapt attention. And I will be passing the mic to Joseph, who would be rounding up this wonderful conversation with a closing remark. Over to you, Joseph.
Awesome. Thank you, Lydia. And thanks everyone for your time, energy, and sometimes sweat, blood, tears, all that good stuff. Yeah, I just really want to say, sort of from my perspective, from Leo's perspective as well, it's really kind of incredible to see so many young people. I think I'm a young person still, but so many young people engaged in these sort of topics, talking about things that both are things that are kind of known to us, and sort of, we need more co-design in these sort of spaces. Things that are less known to us, for getting Kate to remind us, for example, on the importance of optimism and how we can't get ourselves stuck in too much movement, or either it's all good or it's all bad. And so just some really interesting conversations around sort of the variety of topics that were covered, I think was really interesting to me as well, whether that's actual implementation of a wearable device and sort of the cushy baby stuff, making sure that we're aware of sort of the environmental impact of the work that we're doing. And so just a really impressive way to sort of summarize the breadth of digital health research. And from our part, I just want to say thank you as well, special thank you to the editors who dedicated their time to providing feedback and constructive commentaries to you guys. Hopefully that was taken in well. But Nicole Lee Yessen up at McGill University and Harry Hawkeyes at the University of Pittsburgh both just want to make sure that they get some recognition for putting in their time. But Leo and I really always do love hearing from you guys. And as Leo says, if you ever want to have a engaging conversation around what it means to be an engaged young person, what it means to be developing interpretable machine learning solutions, we're always happy to have those conversations. And I hope that this isn't the end of our time together. So yeah, just a massive thank you from us. And hopefully we'll get to hear from you guys in the near future as well. Whitney, I give you the talking stick.
Thank you so much. Thank you, Lydia and Caroline, for your moderating skills. Thank you to all of the authors who shared your papers, some of your key findings, and also some food for thought for moving forward. And then again, just a huge thank you to our partners, Joe and Leo, for joining us today from PLOS Digital Health, and everyone else that was involved in kind of making this a reality. If you haven't already joined the My Health Futures network for all future opportunities that are available for network members, and stay in touch. So drop any questions to team at DTH-Lab, and we'll make sure that we share them with the authors or connect you to the people who can answer your questions. Thank you all very much. Wishing you a lovely rest of your day.
Awesome. Thank you so much, guys. Take care.